Application as nurses. The Code of Ethics for Nurses states that the nurse's primary duty is to protect the rights of their patients, and as we established, autonomy is generally considered a patient right. By advocating for our patients to the rest of the medical team, we become a voice for them to the physicians who are helping make their medical decisions and also writing orders for their care. As mentioned previously, autonomy is not being respected if our patients do not fully understand their options, the consequences of their choices, and what choices most closely align with the goals that they have set for themselves. In our text, Beauchamp and Childress discuss the importance of not merely having a respectful attitude to show our patients that we are respecting their autonomy, but to also show them that respect through our actions. They state that examples of this include not only giving patients the freedom to make choices without interfering, but also championing them and helping to build them up with our words and actions. I think that this is a very important part of autonomy and helps elevate our care because words can only mean so much. When we show our patients that we respect their autonomy through understanding their goals for themselves, knowing desired quality of life, and educating them, we show them that we truly respect their freedoms and are helping to give that to them. The case that we have highlighted with AG shows how autonomy can be respected even if we don't agree with the outcome that was chosen. I think that most practitioners looking at this case from an unbiased point of view would disagree with a transfer to hospice if a person has the ability to live and recover with treatments, especially in the setting of mental illness. AG technically had the ability to live, but she chose a different option. However, in her case, the court upheld her autonomy and allowed her transfer to palliative care. In this situation, you could say that her autonomy was highly valued, and that was showed through the actions of her transfer to palliative care. There are other cases where we may not agree with the choices the patient or family has selected, but if the patient is educated and has the capacity to make that choice, then we must respect their autonomy and support them in their decisions. Lastly, part of respecting autonomy also includes assuring that the patient has a good support system. Cagellan et al. States that their study confirmed that a patient's autonomy is very closely associated with their access to a good social network. As previously mentioned, autonomy cannot simply be respected as a right the patient has with disregard to everything else. Cagellan et al. States that an ethical problem arises in cases where autonomy is expected, but the patient's capacity is limited. This is why establishment of a social network is so important for our patients. The people that are close to them and know them very well are the best to help support them in times of decision making, especially when capacity is a limiting factor for them. As a nurse, we have the ability to assess our patient's social situation and help encourage them and educate them on how to maintain that social network or build that up.